Hey there, if you've come across this video, then you've probably been researching something like back pain or back surgery or microdiscectomy, something like that, and you've come to the right place, or one of many right places, as I am about 10 weeks into the process from back pain to where I am now, which is in kind of a rehab kind of status. I wanted to get on here and just throw out a little video because when I was researching this myself, from the moment I started feeling back pain back in October, YouTube videos and testimonials have helped me as much as anything else. In some cases, more than the medical consultations. So I want to make these videos, and I'm going to try to keep them short, and so I'll probably break it into a few videos, starting first with my initial feelings of pain and stuff, going into something crazy that happened during the process that was unexpected, and then kind of into the choice I made between more conservative versus surgical and stuff like that. And then any video after that will have to do with rehab or recovery, that kind of thing, and what I'm allowed to do, what I'm not allowed to do, all that jazz. Anyway, so back in October 2016, so just last October, right towards the end of the month, I started feeling some pain in my upper right butt, and it wasn't terrible, just kind of a shooting little jabby little pain. Nothing. I mean, I do a lot of working out, and so little pains are not unusual. But it kind of got worse the next day, and I had experienced something like that on the left side 1 year earlier. Went to a chiropractor, and within 4 visits, it was cleared up, totally gone. So in my infinite wisdom, I went to a chiropractor to see if I could get rid of it this time. First visit, nothing changed. Second visit, nothing changed. It wasn't feeling any better. In fact, it's kind of feeling like it's gradually getting worse. And what I had was, like I said, not a terrible pain yet. Started out just kind of gradually increased. Went to my physician, who's a DO, and he's into the adjustment kind of thing as well, and so he adjusted me. Still didn't feel better. Had one more chiropractic visit, and the day after that one, November 8th, I got up in the morning and was in a lot of pain. It was way worse. Took some pain medicine of some kind to get me through this video conference I had to do, or phone conference rather. And right after that, the pain kind of shot through me like a lightning bolt, and I was down on the ground. The only thing I could do was lie down flat on my back, and even then it was like spasming, like electrical shocks going through the middle of my butt, the right side, the upper part, and not a teensy bit down my legs. I didn't really feel so much pain in my back specifically, but that shooting pain, which if you've ever had sciatica, I guess probably that's kind of what it's like. I've never had that, so it was very weird to me, and it was pretty intense at moments, especially if I tried to stand up. At any rate, we called my doctor, couldn't get in. They said go to the emergency room, so we went to the emergency room, went to the ER, had not a great experience there. 7 hours and $11,000, I kid you not. Later, they decided it was musculoskeletal and go follow up with your doctor. So 7 hours, $11,000, no closer to an answer than I was when I started. Had another visit with my primary guy. He got me more situated on pain medicine that would help me get through, 3 to 4 hours at a time. And I was living on the couch, flat on my back, couldn't do anything, couldn't work, couldn't walk, couldn't go to the bathroom without, I was just out without a lot of pain. And if you're experiencing the pain, you're probably aware of what I'm talking about. I should reiterate that I did not do anything obvious that caused this. I didn't like lift something and go, ah, or twist funny and go, oh, my back. It was nothing like that. It was like teensy little pain showed up one day, and then it got worse and worse and worse. My doc finally said, look, let's get you scheduled for some MRIs, and the earliest time they had was November 23rd. It might have been the 24th. The Thanksgiving was the 24th, so the 23rd. The night before the MRIs, I started getting a little abdominal pain in my right side. I thought it was related to the back pain, Um, my wife thought otherwise. By the time of the MRI appointment the next day, it was a little worse, and she was like, "We need to check that out." So, along with the MRI, she got them to do a CAT scan on me, and her intuition turned out to be right, because about an hour later we got a call, and the CAT scan showed acute appendicitis. So the night before Thanksgiving, I had emergency surgery to remove my appendix, and that just really complicated the whole situation. Now I did get some good pain meds for my appendectomy, and that helped kind of the back pain, but it just complicated the whole process because I couldn't really go on any appointments for my back or the nerve pain that was shooting down through there, because I was flat on my back, healing from the appendix stuff. So I'm going to just kind of stop there and probably go on to another video, because some things happened during the appendectomy. Um, Talking with the doctors there, they recognized a couple things by watching me walk. They recognized that there was a nerve problem, and some of the things that they told us and stuff guided us to the kind of on the right path towards what eventually occurred. So I'll stop there. Is there anything else I wanted to add to that? Something? No, that's good enough. The next video we'll pick up from here and detail kind of the rest of the story. So that's it for here. Thanks.